Hello, we are Vanguard Consulting Group, and today the initiative we have for Village MD is Mindcare, Bridging Wellness and Health. So just for a quick introduction, I'm Abelardo Moreno.
I'm Rohan Mahasamudram.
And I'm Lincoln Fitzgerald.
So just a quick overview of what we have for you today. We have a situational and SWOT analysis followed by our strategic issues, and then we have our recommendations and how we plan to implement them. Finally, we have a financial analysis followed by a few alternatives. So our situational analysis, we broke it down externally and internally. Currently, Texas is ranked last amongst the 50 states in mental health, access to mental health care, and this is a good representation of the gap that's in behavioral health. Internally, Village MD has 10 freestanding clinics across the Houston area, and these clinics are in a value-based care model, and the goal is to strive to reach communities where patients live and work. So now for a SWOT analysis. The strengths of Village MD currently are the 10 clinics that they have. They have a broad outreach to patients, and there's a high traffic amongst them. For the weaknesses of Village MD, we know that they had some ideas on behavioral health care, but they don't have a permanent plan as we speak. As a result of this, physicians are frustrated with the suboptimal behavioral health care, and So on to the opportunities. Village MD has the ability to fill in the gap for behavioral health in Houston, and there's a few more opportunities that we have, but we'll go into that in much more detail in a little bit. The threats for Village MD are primary care groups that already have an established behavioral health plan, as well as being corporate owned, and this may cause some hurdles for new initiatives. So onto the strategic issues. We have inadequate management of behavioral health issues, followed by increasing prevalence of mental health issues and the lack of behavioral health marketing presence. Being corporate owned, financial viability is also a problem, and the final strategic issue we have is physician buy-in. We know physicians are frustrated with the lack of behavioral health care in Village MD. However, the Mindcare initiative should be able to fix this, and there should be, however, there will be a few slight changes in their day-to-day work life.
So before we get into our recommendations and strategies, we'd like to start off with a patient story of what is not representative of the entire Village MD population, but an example of what a Village MD patient might encounter. So this is Marcus, who is 33 years old and works in investment banking. He has an annual checkup with his Village MD provider and plans to address his behavioral health concerns. As he's going through his visit, he's taken aback when his Village MD provider says that they provide no sort of behavioral health services. Instead, he's provided with a long list of contact information for behavioral health professionals that he can potentially reach out to or be referred out to. After about 2 months or so, he's frustrated and disappointed as he's made no progress on his mental health concerns and will forego foreseeing behavioral health services. So let's get into our recommendations and strategies. And this is what we're calling the Mindcare initiative. This is a two-pronged approach, the first being establishing the initiative itself. And that involves PHQ-9 screenings, clinically licensed social workers, partnering with a telebehavioral company called AptaHealth, as well as developing psychiatric nurse practitioners. The second part of the Mindcare initiative is promoting the behavioral healthcare model itself. And that includes promotional materials, community events, university partnerships, and website modifications. So let's jump into the PHQ-9 questionnaire itself. This is a mental health assessment that will score patients on a scale based on their depressive and anxiety symptoms. What this essentially does, or before I get to that, currently Village MD has no sort of mental health screenings in use, and physicians even lack the time to discuss mental health issues with their patients, which also leads into why patients are reluctant to discuss mental health concerns and behavioral health concerns overall. And so in the future, what this can look like is all patients will be offered a PHQ-9 questionnaire at least once annually. And what this does is open the door for patients to discuss their concerns with their providers and just get the ball rolling on these sort of conversations. This also saves providers time and assists on being able to figure out what the proper follow-up care treatment looks like. And so who will be assessing these PHQ-9 questionnaires? That will be our clinically licensed social workers. And what we are planning to do is start off with 10 clinically licensed social workers who will be 5 in person and 5 virtual to cover across the 10 PCP clinics at VillageMD. So at its current state, VillageMD patients get referred out of their facilities to get any range of behavioral health services. As well, PCP and mid-level providers lose touch on their patients' care when they are getting referred out. And so in the future, what this could look like is patients have access to in-person and virtual behavioral health services, and these clinically licensed social workers will be taking care of intake consultation as well as follow-up visits. As a side effect of these clinically licensed social workers, additional patients will be attracted to VillageMD, realizing that they now provide these sort of behavioral health services. So in tandem with our clinically licensed social workers, we are planning on partnering with a telebehavior company called AptoHealth. Based on an AptoHealth case study, their services have been shown to decrease depressive symptoms by 44%. And so as of right now, patients are getting referred out of VillageMD, like we said, for any range of behavioral health services. One of the important factors of AptoHealth's partnership is that they are able to provide psychiatric services. In combination with these psychiatric services, we can manage the load that our clinically licensed social workers take on by giving majority of our patients to AptoHealth and keeping the workload manageable for our clinically licensed social workers. What this aims to do is complete the behavioral healthcare process, where now patients can receive a range of behavioral health services such as consultations all the way to psychiatric services. But for future development, we are looking at developing our own psychiatric nurse practitioners. And what that looks like is a 2-year program at the University of St. Thomas where we'll pay for their education, and by year 3, they will be certified to be providing these psychiatric services. And essentially the benefit of this is having access to in-house psychiatric services. So rather than depending on AptoHealth completely, now we can provide the whole entire continuum of care, all the way from PCPs, mid-level providers, clinically licensed social workers, and now our psychiatric nurse practitioners. And this also shows that we're investing in our staff to be able to provide them growth opportunities.
Now that we've covered the foundational recommendations for the Mindcare initiative, we're going to go into the timeline. Starting with year 1, we see the system-wide rollout of the PHQ-9 screenings across all of our clinics. We are going to hire those 10 social workers. Throughout the Mindcare initiative, we're aiming for a 50-50 split between our in-house staff of social workers as well as those that will be online providing those telebehavioral health services. We begin our partnership with AptoHealth, and we give those nurse practitioners the opportunity to pursue additional education. For outreach and engagement, we're looking at local partnerships, promotional materials physically in our clinics, as well as revamping our website to accurately reflect the services we provide. In years 2 through 5, we see a steady growth of our social worker program at 2 per year with a different strategic focus each year. Our strategic focus for year 2 is going to be establishing a connection with our existing patient population and seeing how we can connect better with them and meet them where they are. In year 3, we're recognizing the achievement of the nurse practitioners that sought that additional education as to now be certified psychiatric nurse practitioners. Our strategic focus in year 3 is going to be focused on developing relationships with universities and colleges in the Houston area to expand the potential patient population that will benefit from these behavioral health services. In year 4, we're looking at solidifying our existing relationships with colleges that we started the year before, as well as reinvesting into the relationships we have with our existing patient population and community. Year 5 is going to be focused on making slight tweaks and implementations to the Mindcare initiative as needed so that it is a sustainable model into the future. This is what the patient experience will look like during the Mindcare initiative. We see that the patient experience starts whenever they fill out that PHQ-9 survey that prompts a consultation with the licensed clinical social worker. From there, based on our availability as well as the expected needs of that patient, they'll either be referred out to AptoHealth services or scheduled internally so that we can see them quickly within our own facilities. A key point of this process is that primary care providers are looped back in and get an update onto how their patients are doing so that we have that complete continuum of care. This is an example of what some of our promotional material could look like online as well as physically in the clinics. Some of the feedback we're seeing from providers is that patients are reluctant to speak about mental health challenges as well as may only present with some somatic complaints. The advertising we're designing is designed to target both of these by encouraging patients to speak up about their mental health challenges as well as listing those somatic complaints we're seeing as a potential indicator for experiencing a mental health challenge. These are some universities that have a Master of Social Work program in the state of Texas. Last year, we had a fantastic partnership with the University of Houston and their program, and we're looking to continue that and expand that program so that we can encourage the pursuit into this field as it is a significantly needed area, as well as developing a talent pipeline and relationship with these universities into the future, and really showing our commitment to Texans helping Texans. These are some community engagement activities that we are planning. We're seeing educational workshops, which are going to be Q&A style sessions so that we can inform patients better of our services, as well as they can get to meet our providers outside of the clinical setting. We're also looking at tabling events and sponsorship to get our word out there, as well as just getting in community engagement, buy-in, and spreading our education. And then we're also showing community fundraisers for our commitment in mental health improvement, outreach, and reducing the stigma associated with mental health challenges. Now we're going to go over some of the financials related with the Mindcare initiative.
Getting into the prospective financial analysis for VillageMD, as well as the Mindcare initiative, there were a few key financial assumptions that needed to be made. First off, we compared VillageMD to similar for-profit entities in order to get a better idea of how much each expense as a percentage allocates towards the total net operating expenses for a for-profit clinic. Therefore, we assumed VillageMD is operating at about a 10% profit margin in year 0. Moving on, we also worked under the assumption that the average physician income will increase by about 3.8% on a compound annual growth rate for physicians. Moving on, apart from our actual Mindcare initiative, we're assuming VillageMD themselves, without the initiative, will not be hiring any additional staff throughout these 5 years. That is not changing their ratios in clinical to non-clinical staff. We don't want to make any assumptions on their hiring practices and therefore did not do so. Moving on, a very important assumption for our revenue calculation was assuming work RVUs are reimbursed at the same rate throughout the next 5 years. As we've seen, there's a big fluctuation in RVU reimbursement for the past few years, and also the estimation on that was not justifiable in our case, so we decided to keep that consistent. And lastly, all VillageMD locations are currently leased is a major assumption for our occupancy cost analysis. Now I'll bring your attention to the top left, and this is our 5-year pro forma pre-Mindcare, and we're going to be looking at the net operating revenue for year 0. So we looked at the annual physician-patient volume that they're seeing and how much that equates to billable work RVUs. Therefore, within the 10 clinics, we found a net operating revenue in year 0 to be $52.5 million. Moving down that column, we have our diligently calculated operating expenses, leaving us with an earnings before insurance, taxes, depreciation, and amortization to be about $4.2 million. Now, how do we account for growth for VillageMD throughout the next few years? We look at compound annual growth rates for, first off, the outpatient market for primary care. That's growing at about 3.26% on a national basis. Moving down, we also wanted to account for a 3% increase for our employees in employee salaries and wages in order to deter employee turnover, as well as account for inflation. As aforementioned, the physician salary will grow at 3.8%, and finally, the drugs and medical supplies will grow at about 3.4%. All in all, the big takeaway from this slide is looking at the earnings before insurance, taxes, depreciation, and amortization, and seeing how stagnant that is in that growth, only fluctuating about 0.5% from year 1 to year 5. Now, looking at how this can change with Mindcare, I want to bring your attention to the bottom of our screen, where we have Mindcare operating revenue and Mindcare operating expenses. I'll get into just how I calculated each of these here shortly, but the main thing from this is how profitable this Mindcare initiative can be, as well as provide great services to our patients. We see a growth from year 1 to year 5 of our initiative of 2 extra percentage points for our profit margin. Now, moving on to how did we calculate these revenues? First, we need to see how many patients will actually utilize this service. Without getting too much into the statistical backing of our findings, we found about 15% or 26,000 patients are going to use this service starting year 1. Then we needed to assume how many on average visits will they see a psychotherapist or a psychiatrist, and we found a conservative, empirically backed number to be about 3. And moving on, our social workers can use codes like 90791 for intake sessions and 90832 for follow-ups. When our psychiatric nurse practitioners come into play, they can use more lucrative codes like 90792. And then moving on to our expenses, we're proposing a big rollout for our initiative, and all expenses need to be accounted for. Therefore, we looked at salaries and wages for our social workers, HR and administrative staff expansion, as well as a medical officer to ensure compliance, as well as high quality practice. We also accounted for schooling expense, as well as the technology and telehealth expansion costs that will be important to improving that care. And two very important expenses for us was advertising. We want our patients who are currently existing at Village MD, as well as possible patients in the Houston market looking for behavioral services to know that we offer this now. And additionally, professional consultants will be in play for us. We'll have a legal counsel on retainer to mitigate risk and also ensure legal compliance. And additionally with this, business consultants on a as-needed basis can come in to make sure our performance indicators are getting where they need to be.
So the last change that the Mindcare initiative has for Village MD is not necessarily on the website itself, but also the brand of Village MD. Currently, potential patients are not able to make an appointment for mental health consulting, so this will be changed with the Mindcare initiative. Village MD will also be able to put on their services page that they do behavioral health for their patients. Now let's revisit Marcus. With the Mindcare initiative, Marcus has access to behavioral health services almost immediately. This keeps the patient-provider connection strong and also enables early intervention and prevention. Marcus is a representation of not only one person, but also the patients of Village MD who trust the physicians and their providers. Now for a few alternative solutions that we went over. The first was independent psychiatrists. This does increase access and have specialist expertise for care for the patients. However, there is a lot of salary that comes with this and a few recruitment barriers. The next alternative solution was a complete telebehavioral health partnership. This does access and is very cost effective. However, this basically gets rid of the patient-provider connection and there's revenue left on the table. And the last alternative solution was a full behavioral health facility for Village MD, as this does bring full comprehensive services in-house and gives Village MD a good brand recognition. This is a large capital investment and there is a lot of recruitment barriers with this. So all in all, the primary goal for Mindcare is to bring behavioral health services to the patients of Village MD. Finally, the Mindcare initiative will help Village MD reach their mission of bringing primary care as well as behavior care to communities of which patients live and work. Thank you. Are there any questions?